For decades, the advice has been simple. Drink more water, 8 glasses a day, stay hydrated, and most people over 60 do their best to follow it. A glass with meals, a sip here and there throughout the day, and still go to bed with their tissues quietly parched. Because timing matters as much as volume. And the window before sleep, it turns out, is one of the most important and most overlooked hydration moments in the entire day for a body over 60. Adding lemon to that water is not a wellness trend. There is specific published chemistry behind what lemon does when it enters a body in those final hours before sleep. Some of it is genuinely protective in ways that compound quietly over months and years. Some of it requires caution. All of it is worth understanding clearly, because the difference between this habit helping you and this habit working against you comes down to exactly how you do it. A quick and important note before we go further. My name is Dr. William Lee. This channel is dedicated to reviewing what the published research actually shows about health after 60, and explaining it the way it should have been explained to you years ago. I am not your personal physician, and nothing in this video is medical advice. Do not change your medications, your diet, or your treatment plan based on anything you hear here without first talking to your own doctor. With that said, here is what actually happens inside your body when you make this one small change consistently at the end of the day. Stay with me through the full picture today, because there is one specific effect of this habit, one that directly protects a part of your body that silently suffers in the overnight hours, that most videos on this topic never mention. It also happens to be the most evidence-backed finding in the entire literature on this subject. I want to give it the space it deserves. Before we start, drop your age in the comments right now and tell me, have you ever tried lemon water at night? And if you did you notice anything different? I read every one of these. Your experience may be the exact thing someone else in this community needs to hear. Now, let us talk about what is actually happening inside your body between the ages of 60 and 80 while you sleep, because understanding that window changes everything about why the timing of this habit matters. After 60, your kidneys have lost roughly 30 to 40% of the filtering capacity they had at 40. Your sense of thirst has dulled significantly. Research from the European Journal of Clinical Nutrition has documented that adults over 65 show a markedly blunted thirst response compared to younger adults, meaning you can be genuinely dehydrated without feeling thirsty at all. And while you sleep, typically 7 to 9 hours, your body continues losing fluid through respiration and minor perspiration, with nothing coming in to replace it. Think of your kidneys overnight like a water treatment facility, running a reduced night shift. The work does not stop. Waste products are still being filtered. Compounds in the blood are still being concentrated, processed, and prepared for excretion in the morning. But if the system is already running low on fluid when the shift begins, the plant works harder, and certain chemical byproducts begin to concentrate in ways that create real problems over months and years. A glass of lemon water in the 30 to 60 minutes before sleep is not a large intake, 8 to 12 ounces depending on your comfort level. But what it does is reset the overnight fluid baseline at the moment when your body needs it most. And the lemon adds something specific that plain water does not carry. That something is citrate. Citrate is the primary active compound in real lemon juice. One full lemon squeezed into water delivers roughly 1.4 to 2.5 grams of citric acid, depending on the size and ripeness of the fruit. When citrate enters your system, it does something specific and well documented in the research. It binds to calcium circulating in the urine and physically prevents it from crystallizing with oxalate. It keeps the pieces of a potential stone from ever finding each other. This is where the most compelling evidence for this habit lives, and I want you to understand why it is particularly relevant to you after 60. Kidney stones affect roughly 1 in 11 Americans, with incidence rising steadily after middle age. The most common type, calcium oxalate stones, form with particular frequency during the overnight hours, precisely because urine becomes most concentrated during sleep. When the kidney is filtering on a reduced fluid supply, calcium and oxalate in the urine reach their highest relative concentrations. The conditions for crystallization peak, and adults who are already running low on dietary citrate, which is more common than most people realize, have essentially no natural inhibitor in place during those hours. A study published in the Journal of Urology examined the effect of lemonade therapy, lemon juice diluted in water taken consistently, on patients with low urinary citrate, which is one of the primary documented risk factors for recurrent stone formation. After 4 years of this intervention, stone formation rates dropped from an average of roughly 1 stone per patient per year to 0.13 stones per patient per year. The researchers concluded that lemon juice significantly raises urinary citrate levels and represents a clinically feasible dietary strategy for prevention. A separate analysis in urological research found that dietary citrate was associated with a measurable reduction in calcium oxalate crystal supersaturation, the technical measure of how close urine is to forming a stone at any given moment. Consider someone like Robert. He is 67 years old, a retired contractor from Ohio, and his first kidney stone at 63 sent him to an emergency room for an overnight stay that he describes as the worst pain of his life. His urologist tested his urine afterward and found chronically low citrate levels. His body simply was not producing or retaining enough of the crystal inhibitor. He was told to drink more fluids. Nobody explained why timing mattered or what to add. When Robert began a glass of lemon water 45 minutes before bed 4 nights a week, not every night, 4 nights, his follow-up urinary citrate levels improved measurably within 3 months. Robert is a composite, a pattern that appears consistently in the dietary stone prevention literature, not a specific individual patient. But the pattern is real, reproducible, and backed by multiple lines of evidence across 4 decades of kidney stone research. The practical preparation matters here. 1/2 to 1 full lemon squeezed into 8 to 12 ounces of room temperature water. Not lemon juice from a plastic bottle labeled lemon flavoring. Those products frequently contain negligible actual citrate. Real lemon, squeezed directly. Drink it through a straw. I will come back to that specifically and explain exactly why the straw is not optional. And drink it 30 to 45 minutes before bed, not immediately before lying down. Let me stop here for just a moment. Even when we talk about blood sugar, kidneys, sleep, or everyday senior health habits, one thing is always connected: the heart. That is why the team at Senior Insight Press created Heart Safe After 60, a simple guide to help seniors spot the warning signs before it is too late. It is a complete 55-page guide that covers every cardiac warning sign, the 10-minute emergency protocol, the overnight protection system, and a 90-day heart protection plan you can start implementing today. Most importantly, it includes the full list of cardiac tests your doctor may never have ordered for you, including the lipoprotein A measurement and the coronary artery calcium score that can predict a cardiac event with remarkable precision. The link is in the description. It is from Senior Insight Press, published specifically for adults over 60 who refuse to leave their heart health to chance. Now let us get back to our topic. Now let us move to what lemon water does for your digestive system during those final hours of the day. And this one requires the full picture because there are 2 sides to it. After 60, gastric acid production tends to decline in a significant portion of adults, a condition called hypochlorhydria that often goes undiagnosed because its symptoms are so easily attributed to aging in general. Bloating after meals, a sense of fullness that lingers longer than it should, food that feels like it is sitting. When stomach acid is lower than optimal, the food consumed at dinner is still being broken down more slowly when you approach sleep. Proteins are incompletely digested. Digestive transit slows. The gut is still working at the end of the day on a system that is running below its designed capacity. The citric acid in lemon water provides a gentle, mild acidic stimulus. Think of it as a quiet knock on a door that is partially closed for the evening. A modest acid addition does not replicate or replace the full environment of a healthy stomach. That requires medical assessment if you genuinely have hypochlorhydria, but it provides a signal that supports the final stages of digestion during the hours when your gut is processing the day's last meal. Here is the other side of this, stated clearly, because leaving it out would be negligent. For adults over 60 who have diagnosed gastroesophageal reflux disease, GERD, or who regularly experience heartburn, acid regurgitation, or a burning sensation in the throat at night, lemon water before bed may worsen those symptoms in a meaningful way. When you lie down, the mechanical barrier between your stomach and your esophagus, a ring of muscle called the lower esophageal sphincter, becomes less effective at holding acid back. In someone whose reflux is already compromised, the citric acid from lemon adds acidity to a system that is struggling to keep acid where it belongs. The same citrate that protects the kidney can become an irritant for an esophagus that is already inflamed. This is not a reason for everyone to avoid lemon water before bed. It is a reason to know your own body and to speak with your doctor about which side of this distinction applies to your specific situation. If you have GERD, regular nighttime heartburn, or have ever been told you have esophagitis or Barrett's esophagus, this habit requires modification or professional clearance before you start. Not avoidance necessarily, but guidance. Earlier timing in the evening, smaller amounts, or greater dilution may change the risk profile entirely. That conversation belongs with your physician. If your digestion is generally comfortable and reflux is not part of your picture, the evidence supports this as a safe and potentially beneficial evening addition. Now, the next thing that happens when you drink lemon water consistently before bed is quieter than the kidney story, but it accumulates over years in a way that matters more than most people realize. One medium lemon contains approximately 30 to 40 milligrams of vitamin C. That is roughly 1/3 to 1/2 of the daily recommended intake for an adult. And what makes the timing relevant after 60 is what your body does with vitamin C during the hours when you are asleep. Overnight is when your body performs the majority of its cellular repair and collagen synthesis. Collagen, the structural protein that maintains skin integrity, joint cartilage, the walls of blood vessels, gum tissue, and connective tissue throughout the body, cannot be built without vitamin C present as a cofactor at every step in its production. The enzyme systems that assemble collagen require ascorbic acid. Without adequate vitamin C available during those overnight repair hours, the reconstruction cycle runs on a partial toolkit. Think of it this way. The overnight repair crew shows up regardless. The biological processes that run during sleep are active, whether you provide the right inputs or not. But without the right materials available, the quality of what gets built is compromised. Collagen laid down with insufficient vitamin C is structurally weaker. Blood vessel walls are less elastic. Joint cartilage replenishment is incomplete. Skin structure degrades faster. Adults over 60 tend to absorb vitamin C from food less efficiently than younger adults due to changes in gastrointestinal absorption efficiency. A modest dose from fresh lemon in the evening provides a small but real supply timed to the repair window. This is not a therapeutic supplement dose, but consistently having some vitamin C available from a real whole food source during the hours when your body is actively using it is a different proposition than hoping what you ate at lunch is still circulating at 2 in the morning. One practical note that most people do not know: vitamin C from lemon juice is most stable in room temperature or slightly cool water. Hot water degrades ascorbic acid significantly. If you add lemon to boiling water or near boiling tea, a meaningful portion of the vitamin C is destroyed before you drink it. Room temperature water preserves it. Now let us address something that affects how you feel every morning more than almost any single factor after 60. Blood sugar through the overnight hours. Dinner tends to be the largest meal of the day for most adults. The carbohydrates from that meal, whether rice, bread, pasta, potato, or fruit, trigger an insulin response that takes several hours to resolve completely. Ideally, by the time sleep arrives, blood glucose has returned toward its baseline and the body has begun its overnight metabolic shift toward fat burning and cellular repair. When that transition is delayed because the dinner was large, or eaten late, or high in refined carbohydrates, insulin stays elevated longer than it should through the night. Inflammation signals remain active. Morning fasting blood sugar readings run higher than they should. Over months and years, this chronic nocturnal blood sugar volatility contributes to metabolic deterioration that accelerates after 60. The citric acid in lemon water consumed after dinner has a documented modest effect on gastric emptying rate. It slows the speed at which carbohydrates leave the stomach and enter the bloodstream. Research on acidic compounds and post-meal glucose has consistently documented this blunting effect. The mechanism is different from vinegar, which acts primarily on muscle glucose uptake, but the result is directionally similar: a gentler, slower rise in post-dinner blood sugar, which allows the overnight resolution to begin earlier. Think of it as a dimmer switch rather than an off switch. Lemon water does not prevent your body from processing dinner, it moderates the rate. That moderation matters more at 65 than it did at 40 because the glucose regulation machinery, the pancreatic insulin response, the cellular sensitivity to insulin, the liver's glucose management, is meaningfully less forgiving with each passing decade. If you are on any medication that manages blood sugar, metformin, insulin, a sulfonylurea, have a conversation with your doctor before making any consistent change to your evening routine. The interaction risk between dietary citrate and blood sugar medication is not dramatic, but it exists, and any change to the evening pattern when you are managing glucose pharmacologically belongs to a professional conversation. Now, the hard lines, because there are specific, concrete risks to this habit that most presentations of it skip entirely, and skipping them would make this video incomplete and unfair to you. The first is dental, and it is the most practically important safety instruction on this entire list. Citric acid is genuinely erosive to tooth enamel. After 60, enamel does not regenerate. The protective layer you have is the one you have, and repeated direct contact of lemon juice with tooth enamel nightly for years causes measurable, irreversible erosion. Research published in the British Dental Journal has documented the erosive potential of citric acid across extended exposure, and enamel erosion in older adults is one of the leading causes of dental sensitivity, decay, vulnerability, and tooth loss. The solution completely eliminates this risk and takes 2 seconds. Drink lemon water through a straw every time. This routes the liquid past your teeth rather than across the surface of the enamel. Then wait 30 minutes before brushing. Brushing immediately after acidic exposure, when enamel is temporarily softened, accelerates erosion rather than preventing it. A straw and a 30-minute wait. Those two habits transform this from a potential dental hazard into a non-issue. The second hard line is medication review. Citrus compounds interact with a range of medications that are common in the over 60 population. While lemon is chemically distinct from grapefruit and does not contain the furanocoumarins responsible for the most serious grapefruit drug interactions, the principle of verifying citrus tolerance with your medication regimen applies. Certain calcium channel blockers, specific statins, some antibiotics, and certain antihistamines can be affected by citrus compounds at consistent daily exposures. This is a 5-minute conversation at your pharmacy counter. Bring the list of everything you take and ask specifically about consistent daily citrus juice consumption in the evening. That conversation is not optional if you are on multiple medications. Third, if your doctor has placed you on a potassium restriction, which is common in certain forms of kidney disease and some cardiac conditions, discuss this habit before starting. Lemon juice contains potassium. Not a large amount per glass, but consistent nightly intake adds to the cumulative daily total in a way that is not neutral if you have been given a specific limit. These three caveats do not apply to most people watching this, but they apply to some, and those people deserve to know before they begin. Here is the picture drawn together. After 60, the hour before sleep is not a neutral period for your body. It is the opening of an overnight window during which your kidneys concentrate urine to their highest daily levels. Your collagen repair systems begin their most active synthesis cycle. Your blood sugar resolves the evening's metabolic load, and your fluid baseline drops across hours of sleep with no replacement. Every one of those processes is affected by what you drink in the 30 to 45 minutes before that window opens. A glass of lemon water in that window provides hydration that resets the overnight fluid baseline at the moment your kidneys need it most. The citrate raises urinary citrate levels during the exact hours when stone-forming crystal concentration is highest, protecting a system that, after 60, is increasingly vulnerable to exactly that risk. The vitamin C arrives during the hours when collagen synthesis is most active. The mild acidic modulation of gastric emptying moderates post-dinner blood sugar volatility in a direction that supports healthier overnight metabolic function. None of those effects is dramatic in isolation. Together consistently, across the kind of time frame that compounds, months, years, a decade, they represent a genuine and evidence-supported change to the quality of what your body does while you sleep. The preparation is straightforward: real lemon, half to one whole fruit squeezed directly, 8 to 12 ounces of room temperature water, a straw every time, 30 to 45 minutes before lying down. One conversation with your pharmacist about your medications before you begin. And if reflux is part of your picture, one conversation with your doctor about timing and dose. This is not a cure. It is not a replacement for any prescribed treatment or medically supervised plan. It is a small, chemically specific, consistently timed habit that asks very little of you and returns something real to every system that carries you through the night. You stayed through this entire video. That matters. It means you are the kind of person who takes their health seriously, who understands that the information you have before midnight is worth infinitely more than the information you wish you had after. Senior Insight Press created HeartSafe after 60 for exactly you. Inside, all 7 warning signs explain the way they actually feel in an older body, not the Hollywood version. The complete overnight cardiac risk protocol, the 10-minute emergency action plan, designed to be printed, laminated, and posted on your refrigerator tonight. A 12-point cardiac emergency preparedness checklist, and a 90-day heart protection plan that turns what you have learned into daily, trackable action. The link is in the description and pinned in the comments below. It is $67. Instant download. That is less than one emergency room copay, and it could prevent you ever needing that copay at 3 in the morning. Download it tonight, print the emergency protocol, put it on your refrigerator before you go to sleep. Your heart has been working for 6 decades. It has earned the protection of someone who knows its warning signs. Now tell me, which of the effects we covered today was the one you did not already know about? Was it the kidney stone chemistry, the overnight collagen repair window, the blood sugar modulation? Drop it in the comments below. Your answer shapes what I cover next, and it may be exactly what the person reading after you needed to find. And before you close this, there is a companion to tonight's habit that works in the opposite direction. What you drink in the first 15 minutes after waking, and specifically whether you drink anything at all before coffee, has a direct and measurable effect on morning cortisol, kidney function, and how your blood pressure tracks for the first 4 hours of the day. That video closes the loop on everything we started here, and I will have it linked when it goes up. Take good care of yourself. You have earned that.